Have you ever wondered how blood transfusions work in sickle cell management? Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're diving into a critical aspect of sickle cell management. Transfusion Truths, Blood Therapy Explained, Part 24. Before we explore this life-saving treatment, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people seeking valuable information about sickle cell treatments. Well, blood transfusions are a cornerstone of sickle cell disease management, offering both immediate relief and long-term benefits for many patients. Today, we'll unpack the what, why, and how of blood transfusions in sickle cell care. Remember, while transfusions can be incredibly beneficial, they're part of a comprehensive treatment plan tailored to each individual's needs. We'll discuss the different types of transfusions, their specific uses, and when and why they're recommended. We'll guide you through the transfusion process and weigh up the benefits and risks. Finally, we'll address the potential complications and long-term considerations of this treatment. By examining real-world scenarios, we'll illustrate the vital role that blood transfusions play in sickle cell care. By understanding these aspects, we can better comprehend the role of blood transfusions in sickle cell care. So, let's get started, shall we? First, let's explore the different types of blood transfusions used in sickle cell disease management. There are primarily two types: simple transfusions and exchange transfusions. A simple transfusion is a straightforward process where a patient receives healthy red blood cells from a donor. It's like topping up the gas tank in your car. This type of transfusion is often used to increase the number of normal red blood cells quickly, such as during a severe anemia episode, or to prepare for surgery. On the other hand, an exchange transfusion is a bit more complex. It's like an oil change for your car, where you remove some of the old and replace it with new. In this case, the patient's sickled blood is removed and replaced with healthy donor blood. This type of transfusion is often used during severe sickle cell crises, such as stroke or acute chest syndrome, to rapidly reduce the proportion of sickled cells. The choice between simple and exchange transfusions depends on the patient's specific needs and the clinical scenario. A simple transfusion may be sufficient for a patient with mild anemia, while an exchange transfusion may be necessary for a patient experiencing a severe crisis. In some cases, a combination of both types may be used for optimal results. Understanding these two types of transfusions is crucial as they form the backbone of transfusion therapy in sickle cell disease. Each has its own advantages and potential complications, which we will delve into in later scenes. For now, just remember, simple transfusions are like topping up your gas tank, while exchange transfusions are akin to an oil change. So, whether it's for immediate relief during a crisis or long-term management of chronic complications, blood transfusions play a pivotal role in sickle cell disease treatment. They're not a one-size-fits-all solution, but a tailored approach designed to meet each patient's unique needs. Knowing the types of transfusions allows for better understanding of their application in different scenarios. Now, let's delve into the reasons why transfusions become necessary in managing sickle cell disease. Blood transfusions can be a lifeline in various circumstances for those living with sickle cell disease. One of the most critical scenarios is during an acute crisis. This is when the sickle-shaped cells block blood flow, causing severe pain and potential organ damage. A transfusion can quickly increase the number of normal red blood cells, easing the crisis and providing much-needed relief. Another vital indication for transfusion is stroke prevention. In sickle cell disease, the risk of stroke is significantly higher, especially in children. Regular transfusions can help reduce this risk by ensuring there's always a good supply of normal red blood cells to keep blood flowing smoothly in the brain. Transfusions also play a crucial role in the management of acute chest syndrome, a life-threatening complication of sickle cell disease. This condition can cause severe lung damage, and a swift transfusion can help restore oxygen levels and save lives. Now, let's talk about pregnancy. It's a joyous time, but for women with sickle cell disease, it can also be a time of increased risk. The growing baby needs a steady supply of oxygen, which can be compromised due to the mother's sickle cells. Regular transfusions throughout pregnancy can ensure that both mother and baby get the oxygen they need. Lastly, transfusions may be recommended before surgeries to reduce the risk of complications. The stress of surgery can potentially trigger a sickle cell crisis, but a transfusion can help prevent this by increasing the number of normal red blood cells. Each of these scenarios highlights the importance of transfusions in managing sickle cell disease, but it's essential to remember that the need for transfusion is highly individualized. Some patients may require regular transfusions, while others may only need them during crises or specific situations like pregnancy or surgery. This underscores the importance of personalized care in sickle cell disease, ensuring that each patient gets the treatment they need when they need it. The need for transfusion is highly individualized, underscoring the importance of personalized care in sickle cell disease. Understanding the transfusion process can help alleviate any anxiety associated with the procedure. So let's walk through it together. The transfusion begins with a thorough check of the patient's identity and blood type, ensuring a perfect match with the donor blood. Next, a healthcare professional will insert an IV line, usually into a vein in the arm. This line delivers the donor blood directly into the patient's bloodstream. The actual transfusion can take anywhere from 1 to 4 hours, depending on the type of transfusion and individual patient factors. Throughout the process, healthcare providers monitor the patient closely for any signs of a reaction. Post-transfusion, patients might feel a bit tired, but can usually return to their normal activities fairly quickly. It's also important for patients to stay hydrated and rest as needed. With this knowledge, patients can approach their transfusion with confidence and peace of mind. Like any medical procedure, blood transfusions come with both benefits and risks. Let's delve into this topic to understand the trade-offs better. Regular transfusions can significantly improve the quality of life for patients with sickle cell disease. These treatments can reduce the frequency of painful episodes, decrease the risk of stroke, and even prevent potential organ damage. The benefits of transfusions can be immediate, offering relief from acute symptoms, and they can also be long-term, contributing to healthier lives for patients with this chronic condition. However, it's essential to remember that transfusions are not without risks. One of the most significant risks is iron overload, a condition that can occur when patients receive frequent transfusions. Iron overload can lead to complications such as heart disease and liver damage, so it's a critical factor to consider in the decision-making process. Additionally, there's always a risk of transfusion reactions ranging from mild allergic reactions to severe complications like acute lung injury. Even with careful matching of blood types, there's a small chance that the patient's body might react negatively to the transfused blood. In the context of sickle cell disease, there's also the potential for alloimmunization, where the patient's immune system develops antibodies against the transfused blood. This response can complicate future transfusions and require more specialized blood matching. Exchange transfusions come with their own set of considerations. On the one hand, they can quickly reduce the percentage of sickled cells in the bloodstream without increasing the overall blood volume, reducing the risk of complications like iron overload. On the other hand, they require special equipment and expertise, and they can be more expensive than simple transfusions. In the end, the choice to pursue transfusion therapy is a deeply personal one, requiring careful consideration of both the potential benefits and risks. It's a decision that should be made in close consultation with a healthcare provider, taking into account the patient's unique circumstances, needs, and preferences. Balancing these benefits and risks is crucial in making informed decisions about transfusion therapy. Finally, let's tackle the potential complications that may arise from blood transfusions and how to manage them. Even though transfusions can be life-saving, they are not without their risks. Two of the most common complications include iron overload and transfusion reactions. Starting with iron overload, this occurs when the body receives more iron than it can process and eliminate, typically from frequent or long-term transfusions. The excess iron can damage vital organs like the heart and liver. To manage this, doctors often prescribe iron chelation therapy. This involves taking medication that binds with the excess iron, helping the body to remove it more easily. Now, let's look at transfusion reactions. These are abnormal responses by the body to transfused blood. They can range from mild reactions like hives or fever, to severe ones like difficulty breathing or a sudden drop in blood pressure. Mild reactions are usually managed with medications like antihistamines or fever reducers. Severe reactions, however, are medical emergencies that require immediate intervention. This could include stopping the transfusion, providing supportive care, or even resuscitating the patient if needed. Another complication to consider is alloimmunization. This happens when the body's immune system reacts to foreign substances in the transfused blood, producing antibodies. This can make finding compatible blood for future transfusions more challenging. Regular blood type and antibody screening can help manage this risk. Lastly, we have infectious complications. Although rare thanks to rigorous blood screening and safety measures, there is still a small risk of transmitting infections like HIV or hepatitis through transfusions. To manage this, medical professionals monitor patients closely for signs of infection after a transfusion. It's important to remember that while these complications can sound scary, they are the exception, not the rule. Transfusions are a safe and effective treatment for many sickle cell patients when done under proper medical supervision. Being prepared for potential complications is key to ensuring the best possible outcomes from transfusion therapy. To wrap up, blood transfusions play a pivotal role in sickle cell disease management. We've explored the types, indications, and process of transfusions, along with their benefits, risks, and how complications are managed. Whether it's stroke prevention in children, acute crisis management, or support during pregnancy, transfusions are an indispensable tool in comprehensive sickle cell care. Remember, knowledge is power. The more we understand about sickle cell disease and its treatments, the better we can manage it. Before we wrap up, here's a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this exploration of blood transfusions in sickle cell care. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more content that educates and empowers the sickle cell community. Until next time, this is Maurice reminding you that understanding your treatment options is key to managing sickle cell disease effectively.